My name is Tom Liberti, and I'm the Chief of the Bureau of HIV/AIDS for the Florida Department of Health. I'd like to spend a few minutes with you talking with you about the epidemic in Florida and some of the programs that we offer.
It's ripped from the headlines every day. AIDS is the plague of the 20th and 21st centuries. It does not discriminate by skin color, religious faith, sexual orientation, or economic status. If you are having unprotected sex or sharing drug needles, you risk being infected with HIV. If you think HIV and AIDS has nothing to do with you, think again. In 2002, there were more than 42 million people living with AIDS in the world. Over 11 million of those were between 15 and 24 years old. This epidemic won't go away by itself, and there is no cure. But HIV is preventable. In this special edition of In the News, we'll obtain valuable information and tools for better education and stimulation about HIV and AIDS. The bottom line is get informed, get educated, get tested, and protect yourself.
Hello, I'm Dr. Nelson Adams. Here are the facts about HIV.
The first case of HIV in the United States was recorded in 1981. The disease at that time existed primarily with homosexual men. In 1982, the term AIDS, acquired immunodeficiency syndrome, was first used by health professionals. In 1984, the human immunodeficiency virus, HIV, was discovered. The Centers for Disease Control and Prevention announced that this virus could be transmitted through sexual contact or exposure to contaminated blood. In 1985, the first international conference on AIDS was held in Atlanta, Georgia. This was also the year that Ryan White, an Indiana teenager infected with HIV, made national news when he contracted HIV from a blood transfusion. U.S. Surgeon General C. Everett Koop reported in 1986 that AIDS could be prevented through sex education in the public school systems. The first anti-HIV drug, called AZT, was approved by the Federal Food and Drug Administration in 1987. In 1988, the Florida legislature passed the Omnibus AIDS Act, prohibiting discrimination against persons who have HIV or AIDS.
Thank you, Dr. Adams, for those facts. In continuing the timeline, we've learned that in 1991, Earvin Magic Johnson, a noted professional sports player, announced he was HIV positive. This sounded the alarm in our black community. Other timeline data includes, in 1994, the FDA approved the OraSure test. In 2002, the FDA approved the OraQuick test. This was significant because results were provided in 20 minutes. By the year 2006, the State Health Department released a report entitled Silence is Death, the Crisis of HIV/AIDS in Florida's Black Communities. The report was released in response to data indicating that AIDS is the leading cause of death for African Americans between the ages of 25 and 44. In 2007, the department released a subsequent report entitled Out in the Open, the Continuing Crisis of HIV/AIDS Among Florida's Men Who Have Sex with Men. This report was in response to data indicating men who have sex with men continue to account for the largest share of AIDS cases in the U.S. and Florida. However, in the year 2008, the department released yet a third report entitled Organizing to Survive, the HIV/AIDS Crisis Among Florida's Women. This report provided significant data indicating AIDS is the leading cause of death for African American women between the ages of 25 to 44.
Florida ranks third in the United States in the number of AIDS cases and second in pediatric AIDS cases. Florida has about 10% of the total cases reported in the U.S. Every hour, a new case of AIDS is diagnosed in Florida. HIV/AIDS is the fourth leading cause of death among 25 to 44-year-olds in Florida. The majority of newly infected HIV cases reported today are people under the age of 25. Among African Americans between the ages of 24 and 44, AIDS is now the leading cause of death. There is no cure yet for HIV/AIDS. Prevention is still the best means for stopping the spread of this opportunistic disease. I am Dr. Nelson Adams with an In the News segment about HIV/AIDS. Together, we make the change.
HIV doesn't care if you have sex with men or women. HIV doesn't care if you shoot drugs. HIV doesn't care if you're gay or you're straight. Because once it's inside you, HIV doesn't care where it goes next. Call 1-800-FLA-AIDS today and take the test. Together, we make the change.
In this segment, we're learning the facts about HIV/AIDS through education. The HIV virus travels into our bodies through several paths. The most common path is through unprotected sexual activities such as vaginal, oral, and anal sex. Another path is the sharing of intravenous needles such as drug needles and syringes, the use of other pointed devices used for tattooing or body-piercing needles. HIV is a virus that gets into the body through specific body fluids such as blood, semen, vaginal secretions, and breast milk. HIV stands for Human Immunodeficiency Virus and is the name of the virus that causes AIDS. HIV harms the body's immune system by attacking blood cells called T cells or CD4 plus cells. These cells are the body's main defense against illness. Over time, HIV destroys the body's ability to defend itself against cancers, viruses, bacteria, and parasites. These illnesses are known as opportunistic infections. HIV can lead to AIDS and death. AIDS is the disease that is caused by the HIV virus. AIDS stands for Acquired Immunodeficiency Syndrome. Once HIV has destroyed your immune system, opportunistic infections can develop into life-threatening illnesses. From the simple cold to the flu, TB, pneumonia, and cancers like Kaposi's sarcoma, the body is at risk for infections. A person is considered to have AIDS when they test positive for HIV and their T cell count is less than 200 cells per cubic millimeter of blood. Finally, blood transfusions or blood products may transmit HIV. Saliva, sweat, urine, feces, tears, or any blood-sucking insect like the mosquito does not spread the HIV virus.
Florida is blessed to have a comprehensive approach to fighting HIV and AIDS. In our prevention section, we have a multitude of programs aimed at finding new people who are HIV infected, primarily through testing, and also prevention programs to reduce HIV infection.
We're trying to get that silence broken. We're trying to get people talking about it. We're trying to make HIV and AIDS something normal that our communities and our students and colleges and everyone basically in the whole state, throughout the whole country, throughout the whole world is now talking about something that is now become so silent. This is a preventable disease. We just need to start keeping that awareness out and getting people educated and informed.
It can happen to teens, and that teens need to slow down with what they're doing and recognize that this is a growing problem and it's not going to go it's not leaving anytime soon.
I think that's something that is very important when we talk about HIV prevention, HIV in general, is that we cannot forget that this is a matter of human rights, and that people have the right to know the information, right to know, to have the tools to protect themselves. That is a matter of access of that information for everyone. And the more that we talk about HIV, the more that we have information out there, the better we're off to keep our communities and to keep the people at highest risk safe. If we involve not only government, not only the community-based organizations that are working on HIV, but to involve the whole community, our whole society, and to understand that HIV does not happen only to a group of people, but that can happen to all of us.
The best ways to reduce the risk of HIV infection are: choose to abstain from sexual activities, choose one partner who is not HIV positive, and agree to be sexually faithful to each other. Practice safer sex methods and use protection, like a latex condom or dental dam. Do not use drugs or share needles, and get tested if you are not sure you have been in contact with HIV.
The first thing is you need to reach them in their own environment, make them comfortable. Dress like them, wear your jeans, your sneakers, your polo shirt, Don't go out there in your business suits. They won't want to hear what you're saying. Also, a lot of the population that we work with, they're homeless, so they need basic incentives, like food, help them, get something to eat. They need shelter, someplace to rest their head at night, and, even a condom is considered an incentive for them, and they like when you give them things, things like that. Then you need to find out what they know about HIV. You need to, ask them questions and answer the questions non-judgmentally. Help them to, bridge what they know with what you need them to know. And also help plan their care together. Don't tell them what to do, because that's the next thing with adolescents. They don't like to be told what to do by adults. They want to feel like they're making their own decisions on their own. And then at the end, praise them, praise their efforts, praise every little small step they make, because that helps to build their self-esteem, and they'll make bigger steps after that. When working with adolescents, I found that one of the major barriers of working with them is their fear of exposure. They don't want anyone knowing that they need an HIV test. And also the fees associated with testing at various locations. They're not working, so they can't afford the fees. So they tend not to get the HIV test done. Some things that I found in gaining access to, like schools, community organizations, social services, you have to take your time. You have to, work slowly with them. Little by little, pass out flyers and, gain access to them. They'll tend to, let you in more and more. The more they see you, the more they feel comfortable with you.
Through outreach, we are given an opportunity and a chance to educate the community as to what services, what service organizations are in their community, what local government entities are there that they can access, and also through prevention, educate them, not just educate them why they should get tested for HIV, but give them empowerment, give them harm reduction options, risk reduction goals, things that they can use, a strategy of safety in there they can implement and initiate into their own personal life so that they are protecting themselves. Outreach and prevention is expedient for us to increase it. We need more. Let's put it this way. The harvest is great, the workers are few.
people where they are. Florida, as I already mentioned, has a complete testing program, rapid testing, blood testing, oral testing, in any venue that we believe will help someone know their status, because we believe knowing your status is one of the critical things that you can do in the fight against HIV and AIDS.
I like what the CDC is now advocating, where HIV testing should become a routine part of medical care.
Earlier, a person can get tested, know their status, and get into care is the key to this disease.
Our single greatest preventive measure is for a person to know their status. And if we allow racism, it's time for us to take ownership of this thing. We cannot allow, it's gotten to a point where people won't even seek care because they're afraid of what somebody will think if they see them at a particular institution or a particular center. We must move beyond that. We must move beyond worrying about what people think. Seek care and services. Get educated. Education is power.
We have specialized programs in jails, in community health centers, in migrant camps.
If an inmate is HIV positive, we do a confirmatory test to confirm the positivity of the test. Another part of the HIV of the program is our jail program that provide linkages to medical care and support services when the inmate is released in the community.
And that those men who've been in prison, had sex with other men while in prison, often are not able to talk about it with their girlfriends and their wives when they come out of prison. And we don't know how much HIV is being transmitted in prison, but we know that there's some, and that HIV is making its way back to women in our community. And we need to, and I think all of us have to work together to make sure that Black gay men are not infected, Black women are not infected, Black heterosexuals are not infected. We've made a lot of progress in HIV testing, and I think it's important to look at the ways that we've made progress. You know, we now have rapid testing so that people can get tested and get their results in 20 minutes. A long time ago, people didn't go get tested because it took up to 2 weeks to get your results, and that 2 weeks was like, you know, awful. Torture for a lot of people. And then then it went down to 2 days. But you know, things happen in 2 days. And so people wouldn't go back for their results. But now we get it in 20 minutes. And so, you know, that's a lot of progress. We also now have oral testing. And where it's just saliva swab in the mouth to get your test result. And there are a lot of people who don't like needles or who don't trust needles, because people think, oh, if you're getting a needle, whether it's a flu shot or it's an HIV test, that they're putting something in you. Well, with the oral saliva test, you don't have anything put in you. So if you're afraid of needles, that's progress. We also have strategies like mobile vans and going out into communities so that the test is coming to you. You don't just have to go to the test, because some people can't take a day off, or they can't get across town to where the test might be offered. So we have a lot of progress that we've made, but we do have some fundamental challenges and barriers that Lorenzo has already highlighted. But I think that the most important barrier that we have in our community, and remember, for Black Americans, we still get an HIV test usually right when we have an AIDS diagnosis, or right before we have an AIDS diagnosis. So the person's already been infected for 10 years or so before they get an HIV test.
The epidemic has hit our gay community very hard. Over 40% of the cumulative cases are among men having sex with men.
We have to change the mindset of men whether they're gay or straight, that going for an annual physical, going for an annual checkup, and getting everything from an HIV test to, if you're that age, a prostate screen. And for black men, you should get your prostate screen after 45. You know, so we've got to start doing all of this earlier, and it has to become an annual part of our health care.
People think, well, since I'm not gay, that's not going to happen to me. And the bottom line of it is, it's not what your sexual orientation is, it's what you do.
A woman can give HIV to a man. And if indeed you have a situation that we have in so many black communities where there aren't enough eligible men to go around, and so a man may have several girlfriends, okay? If he gets positive from one of them, he can spread it to the others. So I really think that we need to get a more enlightened way of looking at this and not just trying to find someone to blame.
If we involve not only government, not only the community-based organizations that are working on HIV, but to involve the whole community, our whole society, and to understand that HIV does not happen only to a group of people, but that can happen to all of us.
We must adopt a new and a more positive mindset. We must educate, because it's through education we get rid of fear. A lot of people are fearful of HIV because they haven't gotten educated about HIV. Once you become educated about HIV, you are empowered so that you know how to make quality choices. You know how to have barriers of protection for whatever activity you're going to engage in. It is through education we have the interventions where men learn about harm reduction goals, risk reduction options. These are things that we can learn through education. But if you're not getting educated, then you won't know these things, and therefore you're going to make the wrong choices.
This is a preventable disease. We just need to start keeping that awareness out and getting people educated and informed.
We are worth saving our own lives.
Women, we kind of seem to think like we're not at risk. We seem to think that, you know, it's not going to affect us. We don't have to worry about it. But I think that education needs to be broader. There needs to be more of it out there. And we need to focus more on the issues that are pertinent to women.
Even though I was warned by my relatives and friends that he was HIV, I did not listen, because I said, well, I was going according to the way he looked, and he looked good. And I told myself, I says, it ain't no way nobody with HIV can look the way he looked. So I didn't listen, and we got together, and then a few years after, I found out that he was really HIV positive, and eventually he passed away. And I knew that I was at risk, but I was in denial.
I haven't done anything to anyone, so why should I contract something that is deadly and that no one loved me? I was by myself.
I was in a faithful relationship, and I was raped.
Immediately went into denial. I ran from myself literally for 3 years.
All you got to have for HIV is one qualifier: long, red, and
Don't let the HIV/AIDS pandemic wring out of control. Answer your call to make a difference and call on all of your sisters to do the same.
The minute I found out I had HIV, I said I have to know everything about HIV. I know everything about HIV. How it moves, how it works, how the envelope. I know the GP120. I know everything about it because it's inside me, and that's how I deal with it. I fight it.
Sometimes I'm sick too, and you may not see it in my face, but my brain hurts, my legs have neuropathy. Today people tell me, it's so cool, how can you wear those shoes? Well, I cannot wear closed shoes. My neuropathy hurts. Neuropathy is like needles going on your toes. It hurts. So sometimes my face wants to smile, but my feet are saying, we ain't having it.
I don't think that we died before our time. So if I'm going to get sick, you should see me when I started taking 2 medications that came out. I looked like a pizza pie one time, but I didn't stop. And another time I started another one, and that one I had a big rash, and the doctor said, well, it doesn't itch, so it's not the medication. And I said, no, because it doesn't itch, it's the medication. He said, really? Let me go call. That's why I need a doctor who listens to me, because I know. So he went, and then he came back and said, "You're right." He had called the pharmaceutical company. I knew.
I'm not alone, and I do think we can beat it. If us who have it don't give it to anybody else, and you who don't have it don't catch it, we can win. Thank you.
My boy said, "You're gonna die, Mom?" I said, "Yes, yeah, but not yet. You know, we all gonna die. We know. Thank God, we all take the step. It's natural, but not yet."
We have special programs dealing with pregnant women. We have an aggressive law that requires routine testing of HIV for every pregnant woman with an opt-out clause in the state of Florida. And it's paid off because we've reduced HIV infection from mother to baby to a very, very, very low level.
Without any treatment, 1 out of every 4 women who has a pregnancy will have an infected infant. That's 25%. But with treatments, this percent can be reduced to almost 0.
Interesting enough, in the state of Florida, we have what we call a Mama Bear program, where we work with pregnant females specifically. What we do in this program is we make sure that these females are seen immediately for care and or treatment to ensure that they're having less likely a chance to transmit the virus onto their children.
My experience is most women who are HIV positive and pregnant are compliant and they want to get the help they need in order not to infect their babies. So women become assertive once they know their status and they're pregnant to prevent the babies from being infected.
If a pregnant woman is HIV positive, she can pass the virus to her child through pregnancy, childbirth, and breastfeeding. The facts. Women with HIV can reduce risks to their children. Women can transmit HIV to their babies through pregnancy, childbirth, and breastfeeding. To reduce the infection's effect on your children, do the following. During pregnancy, eat well, get plenty of rest, take vitamins, and get tested. If you are HIV positive, talk with your doctor about taking the drug AZT. Also discuss with your doctor having a cesarean delivery. And after the baby is born, do not breastfeed, but bottle feed your baby instead.
I'm Dr. Catherine Lamprecht, and I'm the Pediatric Medical Director here at the Hug Me program in Orlando, Florida. And the Hug Me program is a unique program that was started about 10 years ago when my partner and I realized that we were seeing more and more HIV-infected children, and we realized that the families needed a lot of support, much more than what we as physicians could provide. This is a disease that affects the whole family, and frequently we'll have entire families, sometimes extended families, who all have the same infection. And we can provide somewhat of a one-stop shopping help for them. With everything from medical care to assistance with social programs and other ways for them to feel more in charge of their disease so that they can manage themselves and their families better. One of the challenges of pediatrics is that the needs change from infancy all the way up through adolescence. The youngster has to be given medicines that taste fairly good, that the parent can get down fairly quickly. The school-age child starts realizing that they're a little different. They're going to the doctor all the time. They're getting their blood drawn all the time. They're getting medications all the time. And then, of course, we get up to the adolescents who have problems and issues of their own. Many of our adolescents have taken medicine from infancy and are kind of tired of it by now. Then, too, we have the adolescents who have gotten HIV during adolescence, either from high-risk behavior or what have you, and that's a very different population with obviously very different psychosocial needs.
The type of information that should be out there, the information that's already out there, the way you can get HIV/AIDS, how it's spread, the people that it affects, and ways to prevent it. That information should be updated and just pressed every day amongst the teens.
The Florida Department of Health, through the Broward County Health Department, has a very special program called the Senior HIV Intervention Project, or SHIP. And the SHIP project targets people over the age of 50. We know that here in the state of Florida, approximately 11% of our cases are in the senior community, and 64% of those cases are here in South Florida. So we knew that this was an area that needed to be addressed, and we knew that this was an area where seniors were not receiving HIV prevention education and really didn't feel themselves to be at risk for HIV. We provide HIV prevention education, we provide HIV counseling and testing services, and we link people who are positive to healthcare and medical care. We also know that within our community, healthcare providers are not aware of the HIV risk of seniors. So another part of SHIP is to address the healthcare providers themselves, providing education and awareness to doctors and nurses so that they're more aware that seniors too have to be assessed for their HIV risk and have to be talked about HIV infection. We've learned that seniors don't really perceive themselves to be at risk for HIV infection. And so they won't come to programs that are specially entitled HIV and seniors. So what we've done is we have programs that are sexuality related or relationship related, or we incorporate HIV education and prevention messages in general health information. Sometimes seniors will come if it's a session on health issues that are more related to, that they're more aware of, osteoporosis, cervical cancer, prostate cancer, and so we have HIV information available during those kind of sessions. We've also learned that seniors pass on this information to their children and their grandchildren, so it becomes almost an intergenerational education program. And we also know that seniors learn better from their peers. And so all of our outreach workers and all of our community volunteers are actually seniors themselves. And so they're going one-on-one and truly talking about the issues that are related to seniors with other seniors.
I don't wake up thinking, oh my God, I have HIV or nothing. No, because, you know, I learned how to embrace my illness. And that's the only way I could survive. Embracing my illness and saying, okay, I got to get up and keep going. You know, your mind is really powerful. And whatever you put in your mind and you say with your mouth, I believe that your body will receive that. So I find, you know, the more I go out, the more I speak about it, it gives me more energy. Yes, I do have my moments that I don't want to deal with this illness because I get up tired or I forget a lot of things or something is happening with me and I hate having this illness. But it's less days than more days. You know, it's more good days than anything else. Because, you know, I'm trying to, from something negative, bring out something positive.
Some of the unpleasant conditions resulting from AIDS are fevers, vision loss, vomiting, weight loss, severe headaches, shortness of breath, difficulty in swallowing, diarrhea, and coma. If you are HIV positive, practice safe sex methods. Get tested, get lots of rest, eat balanced meals, get exercise, take vitamins, get flu shots, and learn more about HIV and AIDS.
We know that the experience that impacts upon a person about whether they're going to come back for their HIV test result or if they're found to be HIV positive, whether they're going to come back to care is how they were treated. So if the receptionist wasn't very nice, they're going to say, oh, you know, they kind of look down on me. I don't know if I want to go back to that place. Yes. Or if the doctor was dismissive and blaming about them getting HIV, they're not going to go back. So our healthcare system has to be fair, it has to be just, and we have to invest in making it more culturally competent so that everyone who comes to a healthcare center, the moment they walk up to that receptionist, is being treated with respect and with dignity.
My name is Ed Jones. I'm with the Hope and Help Center in Winter Park. We're a case management agency. Our job is to try to keep clients out of the hospital. And the only way we can do that is to try to get clients to be in compliance with all the different things that we're trying to help them with. The services we offer are basically a range of things. Housing, food assurance, if they need to see a dentist, if they need acupuncture, if they need to talk about hepatitis C, whatever other issues, mental health therapy, one-on-one counseling, whatever the issue may be, we'll discuss it. But the main thing is to get them immediately into the system where they can get the care and the treatment that a physician can present to them. The stress of HIV and not having family members is really devastating, and those are the clients who we really have to stay on because those particular people really need us the most. Now, after I have the trust of the patient, there's a few basic things that I like to go over with them on. I have to talk to them about really still having sex and what they need to do to protect themselves or their partners. If the client decides to bring his partner with him or her, that's a good sign, because that shows me that they are really willing to get some help. And by bringing another person in the mix, it means that we can talk to that individual openly. First, the client has to support one another. And what I mean by that, they have to be there for each other, give each other encouragement. Because with this disease, there are days when you're really not feeling well, you want to get out of bed. My mother always said, Ed, you're the type of person, you're always listening to everybody else's problems, but you're never handling your own. So I guess that kind of took to where I'm at now, because people like to tell me their problems. If I can get someone to smile or get someone to be compliant with what they're doing, to me, I've already accomplished some things much greater than the monetary things that I'll probably ever get in life.
You can live with this virus of HIV and AIDS, because I've been living with it for 21 years. And I've been a part of this coalition for it's going on 10 years. And I tell you, it has been nothing but a blessing to be around people that can impart into you the hope that you need, especially when you're going through family issues, doctor issues, not knowing really how to deal with the medication and all the side effects that it has. I am thankful.
A combination of drugs for treating HIV is called a drug cocktail. This is also known as a highly active antiretroviral therapy, also called HAART, H-A-A-R-T. This treatment strives to suppress HIV reproduction to fight infection. Over time, any treatment or combination of treatments can lose their effectiveness at stopping the spread of the HIV virus in the body. And not all people infected with HIV can take medicines that are available today. AIDS still remains a disease without a cure, and HIV is still a puzzle which scientists are trying to solve. Protease inhibitors are HIV drugs that work by blocking the action of a protein that HIV needs to reproduce itself.
I was told that I had AIDS, that I had a year left to live, and that I should probably prepare myself to die, say my goodbyes to family and friends. With me, I've relied pretty much on my doctors as far as adherence and the information that they give me for the different medicines out there, because we have a whole listing of medicines now that are available. But what you have to remember in drug treatment is that any drug, be it an aspirin or Stastiva or Comdivir, which you take for HIV, has different effects on every person differently. So you really have to do a lot of experimentation sometimes to find the medicine that will work well with your body, that you have access to from your doctor or particular pharmacy that you get the drugs from, to, how good are you going to be at taking that drug. It's a lot easier nowadays. You can openly talk about HIV and AIDS today where we couldn't back in the old days. But we've still got a long ways to go. We're still not telling the complete truth to kids, to church organizations. Some of that has to do with, how I want to say it, socialization. Church groups not wanting you to talk about condoms, schools not wanting you to talk about condoms or safe sex. It's all abstinence based. Well, that's why me and my wife do what we do in our program. It's because we don't change our programming for any organization. We're going to come in and we're going to tell you exactly what it's really like to live with HIV and what it takes not to get HIV.
If you are a healthcare worker and are exposed, you should seek medical attention immediately.
This is Tom Liberti again, and I want to thank you all for watching this video. and leave you with 3 clear messages in our state. First, we need to prevent new infections. We cannot afford, and our families and friends cannot afford to continue to have the high rate of HIV that Florida has. So we need to do everything possible over the next few years to reduce new infections in our state. Second, we need everyone to know their HIV status. We want to have complete and comprehensive testing availability for all Floridians to know their HIV status, and for men having sex with men to take that extra step and be tested for HIV at least twice a year. And third, for the people already infected with HIV, we encourage you to stay in care, to complete your medicine, to follow the instructions of your physician, because we know the outcomes of staying in care is better for those who do. On behalf of the Florida Department of Health, thank you very much.
For more information about HIV/AIDS, call the Florida AIDS Hotline at 1-800-FLA-AIDS. For HIV/AIDS in Spanish, call 1-800-545-SIDA. For HIV/AIDS information in Haitian Creole, call 1-800-AIDS-101. For HIV/AIDS information via the TTY/TDD line, dial 1-888-503-7118 or visit us online at www.wemakethechange.com. Thank you for joining us for this special edition of In the News. Together, we make the change.